So I think we are live. Hello, all. A very, very good evening to all of you. It's warm in some pockets of the country, while it must be shivering in some other pockets of the country. I don't know. It is very hot out here in Hyderabad. I hope it is at least colder in northern part of India, probably in Delhi. I think Dr. Ravi can talk about that. But yes, we have a very, very highly esteemed guest with us today. I am Ravi from DocTutorials, and I take immense pleasure in presenting Dr. Ravi Bansal, with who has joined us. He has taken a lot of pain actually to join us today, because he has also traveled to make this arrangements for a proper network connection. So we have Dr. Ravi Bansal with us. He is a UCMS Delhi pass out. He is a rank 43, A.I.R 43 in INI CET in May 2024. More importantly, he is A.I.R 5, All India rank 5 in NEET PG 2024. And we are very, very, very happy to host you today, sir. Welcome to the session.
Thank you. Thank you so much, sir, for inviting me.
Yeah. Yeah. So, guys, it is not a regular concept discussion session that you would see on YouTube. It is not a regular MCQ solving session either that you will see on YouTube. It is not about explaining how to get the right answer or anything. What we are trying to do over here, and what Dr. Ravi will take you through over the next 3 hours or so, is an actual live attempt of a GT that he has not seen before. What we want to showcase to you ideally is, how would a topper actually think when he is inside that exam pressure, when he or she is inside that exam setup? On what basis is he eliminating options? On what basis is he analyzing all the clinical parameters given in the question? On what basis is he looking at the images and deciding whether to solve this or whether to leave this? On what basis is he marking a question for review? On what basis finally is his mindset, his thought process helping him to ace exam after exam? That is what primarily we want to showcase to you. Dr. Ravi, the floor is open, and it is open for you to showcase whatever you can help with, whatever you can help your juniors with. A lot of people who are going to attempt the upcoming exams, I'm sure, will very interested to gain insights from you, and I'm sure they will benefit a lot once they see how you think and how you go about attempting the paper. Dr. Ravi, the floor is all yours.
Thank you, Ravi, for the kind introduction. So the basic idea behind the video is the process, the toppers, the thing in the actual exam while giving GTs. Actually, it is said 100% of the syllabus cannot be read by anyone, even by the toppers. I couldn't study 100 of the syllabus, but it's the kind of strategy you use in the exam that helps you scoring more and more. And it is said it is not the attempted question will give you rank. It is the question that you leave that make you rank. So now I will be solving a random GT from the doctoral platform. And now I will be like discussing the every question, the idea behind solving the question, the unfamiliar question. If I leave it, if I do it, if I do attempt it, what is the idea behind doing it? What is the process of eliminating the options? So that's the basic idea behind the video. So now I will be opening a random GT from DocTutorial app, and I'll be tapping on this live stream. So you all get the basic idea.
Sir, are you present? Sir, are you presenting the screen? Vinod, can you put the screen on? Present the screen. Yeah. And thank you, sir. I'll drop off from the video.
Okay, so now we will be going to the DocTutorial test series. So pattern NEET PG 2 sessions per minute and 40 questions each session. So we'll be opening this new pattern GT'24. So let's try it. Let's try solving it. What is the process? How to mark the answer? How to leave it? So yeah, give it a try. So they are general instructions. You can read it, but like I know these instructions. So we are starting the test. So there is the section name, 40 questions, 42 minutes each. So this match should be running behind of your mind. So you have to solve 40 questions in 42 minutes. So basic approach in solving the question is try to read the last line first. So I get the idea what kind of question it is. It is about making the diagnosis. This question, so the question is 20 years old boy willing to participate in a marathon. He has no previous exposure to strenuous exercise, so he visited his dietitian for consultation to improve his physical efficiency. So it's a basic biochem question. So for a physical efficiency, he would need a more like eating is good. So high carb diet is easily digestible and give you energy, more constant source of energy. So I guess high carb diet, I will mark it as option. High fat, and these like mixed diet followed by high fat diet. So I guess this is the right answer because carbs, it is a constant source of energy. So basic biochem question. Second question is microbiology question. There is a photo given. So there is a 7-year-old boy presents with painful swelling over the scalp for 2 months as shown in the image. Which of the basic the causative organisms? So it on the basis of the image, it is looking like Kirion. So Kirion is caused by Trichophyton mentogrophyte, basic dermatophyte. So it cannot be bacterial infection, it cannot be malassezia, it is a dermatophyte. So Kirion, so this is the right answer. Which of the following can cause injuries in the lightning flash, except basic FMT question, expanded and repelled air, compressed air pushed in front of the current, direct contact with fluid, or lightning flash. And expanded. In which of the following conditions ovary function normally? So basic OBGY question. So in MRKS syndrome, we all know MRKS syndrome, their ovaries are normal. There is a problem of syndrome and Swyer syndrome. They are both DDs. So MRKS syndrome will be the right answer. So these type of lamentations where full history is given, full clinical examination is given. So try to read the last line first. What is the likely diagnosis? And you can just overview the options. You get the idea from which subject the question. So after the husband, 60-year-old lady was brought by OPD by her son with complaint that she has become more religious, spiritual, and has lost interest in studies. So the options are I will go for Mania because he has like reduced money in donation. He has a goal to change the society, and she only sleeps for 3 hours. All of these factors going into favor of Mania. So mania you see all of these factors going into favor of Mania. So Mania you see all of the delusional need to change the society. So so CET or CPA, see 2 or 3 questions. Actually, have to. So you have to first hold for the help, then you check for the carotid pulse for 6 seconds and breathing. Then on the basis of the condition, you give start CPR. You cannot directly start CPR. You cannot leave the person without checking, without calling for the help. And before checking the pulse, you have to check for the scene safety, and you have to check for the pulse. So it is a basic microbiome parasite question. Echinococcus is called dwarf typo. Right, Echinococcus is called dwarf typo because it has only 3 segments. So these kind of small questions, you just do it. You do not waste time on these kind of questions. All the following structures form the boundary of the infraclavicular fossa except. So infraclavicular fossa, there is deltoid and between pectoralis major. So there is a pectoralis major, there is clavicle, there is deltoid. Medial border of the first rib, this form the medial boundary of axilla. So no mention in infraclavicular fossa. So you can just go and save the answer. Enrollment for CT scan. Basic Hounsfield unit. So we read so many things about like -100 Hounsfield unit. So you cannot go wrong with these kind of questions. Most common cause of nocturnal aneurysm in children. So most common cause secondary, the children doesn't get mature. So maturation delay is, I guess, most appropriate answer. So what is the first step in management of the patient? The patient is severely injured patient comes with a spinal fracture and unconscious. So basic ATLS guideline, if there is a trauma patient incoming, so you have to spine stabilization of the cervical collar. First step, it is CABCD. So this is the basic you are gonna go with cervical collar spine stabilization because there is a spinal fracture and unconscious. Airway comes after stabilization. During the infiltration of local anesthesia, the highest chance of increased systemic concentration depending on the site of injection is by which of the following. So local anesthetic, if you give options intravenous, they will be maximum concentration. There is a in anesthesia in LA, there is a given percent of is gonna be 80%. It is a common sense question, I guess. All of the following statements are correct regarding crush syndrome, except. So let's read the options first. There is except. You have to note it. Let's see when the yes, myoglobin can obstruct the tubes. The mannitol alkaline diuresis up to 80 per day should be maintained. So let's read there is except. So we have to choose the incorrect option. So fasciotomy can be done after 24 hours of treatment. Let's do fasciotomy we do in crush syndrome. So prolonged crushing of muscle leads to reperfusion injury when the casualty is rescued. Yes, it can happen. Myoglobin get occur lead to renal failure from tubular obstruction, and mannitol diuresis of up to 8 liters per day should be maintained. So in crush syndrome, we maintain diuresis, we give mannitol. These options look right. But the myoglobin urea occurs lead to renal failure or tubular obstruction. I guess myoglobin urea that has iron. So both are looking kind of right, but myoglobin, I guess, basic mechanism is not the obstruction, it's the PCT damage. So I will just mark the question and mark it for the review and next. So a gland that binds to a receptor at a site distinct from the active site, okay, alters the affinity of the receptor for endogenous ligand. It is called. Competitive antagonist cannot be happen competitive at the same site. This is an allosteric modulator. This is a basic biochemistry general pharma question. Agonist, antagonist, they all bind to the same site as ligand, but allosteric is a different site. So image of kind of, let's read the right eye from 1 year. C was a known case of BHL syndrome. On examination, on fundus examination temporal to the disc, a circular grape of cluster of thin walled angiomatous lesion on fundus examination they have given angiomatous lesion. They have given angiomatous lesion. On fundus examination they have given angiomatous lesion. Reason I do not like. I'm not expert in these past slides. So most likely diagnosis they will be capillary hemangioma. No, it should be cavernous hemangioma. Juvenile hemangioma, pyogenic granuloma, these options are out. Capillary and cavernous, I am confused. So in VHL syndrome, we tend to see cavernous hemangioma. Like its mnemonic is 2CP. So we'll see cerebellar and retinal hemangioma. So I will mark it for review and next, but I think cavernous hemangioma is the answer. What is the reference to which census population count is undertaken? It's on the 1st July. Reference of the population is taken on 1st July. This is basic community medicine. So which of the following laboratory finding would be consistent with the diagnosis of NAFLD? Okay. So 45-year-old obese women presents to primary care physician complain of fatigue, right upper quadrant, abdominal fullness of meal. NAFLD diagnosis they have given in the end. She denies alcohol consumption, admit lifestyle. Die high in processed foods, sugar, physical examination, hepatomegaly, laboratory investigation, elevated ALT, AST, lipid profile, high triglyceride level. Which of the following will be considered diagnosis of NAFLD? So in NAFLD, what do you see? NF, there is a elevated serum of ferritin is actually acute phase reactant. So acute phase reactant tend to increase in these kind of condition. There is an NAFLD is given ALT, ferritin will be increased. Elevate of NAFLD. So what is the most likely diagnosis? They have given audiogram. 50-year-old male patient, hearing loss was suspected to audiometry. Audiogram is shown below. So there is a air conduction ground going with the bone conduction. So there is no ACBC gap. So it cannot be a conductive hearing loss. It's gonna be a sensorineural hearing loss. The most likely diagnosis. So you have to choose what is the sensorineural hearing loss among these options. So noise induced is sensorineural. Otosclerosis, dislocation, and Meniere's. For so there is a sensorineural hearing loss. These two are options are out because this cannot be conductive hearing loss. So noise induced hearing loss and Meniere's, they both cause sensorineural hearing loss, but the age is 50-year-old patient, 1000 hertz deep V, 1000 hertz deep V, see it's the boiler notch. So age is also 50-year-old male. So it will be noise in the steering loss. In the menials, which of the following structure is responsible for converting light into neutral signals in the retina? So signal goes to rod and cones. Rod and cones convert into a electric potential. So these are the part of just retina optic disc. There are no rod and cones. Rod and cones will be right answer. Fovea centralis, optic chiasm. These are topographical location in the retina, but the the functional structure converting light into neutral signals, they are rod and cones. They are photoreceptors. So we know the histone structure. They are H2A, H2B, H3, and H4. They form the octamer, and there is H1 histone. Among the four options, H1 is among the. This is the odd option because this forms the linker histone. We all know H2, H2B, H3, H2 form the octamer. So they are gonna wrap the DNA around them. H1 is just linking the octamer between them. So H1 is the least likely to participate. This is also common sense question. Which of the following statement is true for management in larynx presents involvement of left vocal cord, left areolar fold, left ventricular band inverts into paraglottic space. Okay. So which of the following statement is true for the management of this case? So in carcinoma larynx, so the cancer is T4A, I guess, paraglottic space. So in these cases, we go the cancer this advanced. Basic management is radiotherapy and surgery. What can diagnosis? So we have first to make the diagnosis of the case. Then we have to think about the treatment plan. Disease. So it's a mild grade panuveitis. Correct statement. It can occur as a atypical uveitis with trabeculitis. Eyes are red with pupil dilated. Pupils are mid dilated. So they are showing minimum cells in the chambers. So IUP is 60. So there is a uveitis plus increasing thing. It can be fish. There is a like white eye. Eyes are red with pupil dilated. Eyes are mid dilated. It can occur atypically with trabeculitis. So there are like minimum cells, and there is no red eye. There is a white eye, and IOP is also increased. So FHI, I guess IOP is increased. I'm not sure about this question. We will see when we will revisit the question. Following studies of disease of larynx are associated with Interpharyngeal folds on each side are pulled medially to approximate each other. Vocal cord of the larynx are strongly approximated and larynx is pulled upward anteriorly. And each side of larynx are anteriorly. So I guess larynx phase obviously will occur before larynx phase. So I will go for 2 first, then 4. 2, 4, then 1 and 3. Okay. These kind of questions are usually asked in days, 4 to 7 days. So it's like red brown, then brown, and then black. So brown and black stays will occur after 4 days. So these kind of questions just few days before the exam, the table cramming may help these kind of question getting right. C can be complicated with which of the following. Primary period of OPD comes with the increase in SCG, decrease in PA, 12 weeks of pregnancy. So these chemicals are used in obviously down screening in first trimester. C can be complicated. So basic increase in SCG and decrease in PAPA. So the basic we are thinking about Down syndrome. So Down syndrome is trisomy 21. There are no tests for trisomy 15. They tell you in trisomy 13 and 18 all parameters go down. So SCG cannot increase in trisomy 18 and 13. So you can obviously rule out the options. Weight gain, fatigue, postural delays, loss of memories, low speech, dry skin, constipation, cold internal. Basic clinical picture of hypothyroidism. You cannot go wrong about this question. So this is basic hypothyroidism. They are given so many features. They are given weight gain, dry skin with constipation is cold intolerance. Cold intolerance is so severe in thyroid. So weight gain is happening in hypothyroidism. So used to detect neutron powder. So Davala question. So these kind of question you have to cramming type part. Which of the following is the effect of SRY gene? So SRY gene any reason, so it will turn into male. Defaultly, the fetus is going to be a female unless there is SRY gene. So basic embryo question. Which of the following changes in hepatic metabolism best explain increased ketoacidosis in type 1 diabetes? So type 1 diabetes, ketoacidosis occur because there is like relatively deficiency of insulin. So in the liver, obviously, you are going to make that ketone acids. So you have to do the increased beta oxidation. So protein synthesis cannot occur in insulin deficiency. In insulin deficiency, glucose cannot be uptaken by the cells. There cannot be protein synthesis increase in diabetes. So beta oxidation, obviously, there is going to be increased triglycerides in the blood. They will go to the liver and beta oxidation will happen to them. So keto acid will form. So you can just basic biochemistry knowledge and choose the right option. So they have asked about the diagnosis. One step question. They have given me picture. So basic, the first impression of the picture gives me about the it's serous otitis media. This is like honeycomb appearance. So 6-year-old ENT OPD child is suffering from hearing loss. Autopsy picture is given. So you can see the diffusion. So the history of this is also hearing loss. There cannot be pneumonia tympanitis seen after trauma. Laryngitis you will see on the tympanic membrane, not inside the cavity itself. ES1 you will see like irregular, but not like tympanic membrane. So this is the basic the following IOL usually requires a surgical iridectomy to be performed. Okay, so you have to manipulate the iris. So obviously, if you are manipulating iris to put IOL inside the eye, it cannot be PC IOL. So obviously, iris is inside the anterior chamber. So anterior chamber, to put the IOL, you have to like do something with the iris. In PC IOL, you just put in a capsular bag. You have nothing to do with the iris. So basic anterior chamber IOL. Most probably cause. So there's a and there's a liver failure, recurrent episode of vomiting lethargy. These causes problem in the child. So we can think about aldose deficiency. So blood sugar are checked in the emergency department are extremely low. Most probably diagnosis. This is the basic question. Fructokinase cannot cause intolerance. Fructokinase, you do not see these severe type of symptoms. And to differentiate from galactokinase, they have given low sugar, or especially they have written high can use. So there is gonna be symport. Uni is one. This is not an active transport. This is a symport. Two substances going in the same direction with the help of a transporter. So most patients presenting with acute non-granulomatous anterior uveitis will require treatment with which of the following? So basic anterior uveitis treatment is with atropine and steroids. So topical corticosteroids and cycloplegic agents only. Periocular steroids, no use in acute uveitis. Oral steroids, it's the next step, but first you use just drug of choice for uveitis is steroids and atropine. Atropine is cycloplegic. Which type of shock to identify this? So there is a burns, there is a evaporation of the water from inside of her body. So which type of the shock will be seen? So there is a high hematocrit. So obviously she is losing water. So there is no hemorrhages going on. There is just total volume of water, total volume of blood that is going low. That's why the high hematocrit. So it cannot be neurogenic shock. She has no problem with her heart. She is not bleeding out outside of inside. So this is basic hypovolemic shock that is seen in burn. We have 30 minutes remaining and 4 questions. All the following can lead to increase in temperature of the body in her first 2 hours following death, except increase in the body after death. So they are basic, like if you have sepsis or hyperthermia before death, sunstroke, septicemia, cholera. So they will obviously increase the temperature after death. Cyanide poisoning will not increase the temperature. Cholera, septicemia, sunstroke. Okay. Except there was except so cyanide poisoning temperature will not increase. True about primary dysmenorrhea. So prior to the mention, the first line treatment, no, and said associated with psychological factors. Primary dysmenorrhea can be associated. Let's see. Pain start 2 to 3 days prior to the menstrual, resolve in 24 hours. So in primary dysmenorrhea, the pain starts like a few hours before would be the menses, or at the onset of menses. So 1 to 3 days prior, this is a feature of like pathological dysmenorrhea, secondary dysmenorrhea. So I will go with cyclo. 1 day prior, retina in. Everything fluid is under the retina, so it's gonna be a convex shape. Concave configuration, you see interactional retinal detachment, or oval. This is a fake option. So convex is gonna be true. So this is a like long clinical STEM question. They have asked about the diagnosis. So 59 is female, old female, upper abdominal pain relating to back, fatigue, loss of appetite, nausea, and anorexia. She has considerable weight loss. On examination, she has intense yellowish discoloration. So she has jaundice. She also noted her urine was dark. Urine was dark yellow, stool were very pale. So this is going in the direction of obstructive jaundice. Laboratory test revealed a very high level of bilirubin expected. Elevated urinary bilirubin expected. Liver transaminase enzyme was slightly elevated. So this is post-hepatic obstruction. So liver enzymes are not so very high. They are slightly elevated. Why it is high? Because of the ALP was much elevated. So all these lines are explained over diagnosis. Correctly placed. So membranous nephropathy is associated with. So membranous nephropathy we see in HIV. SLE we can see. CLL, hepatitis B, we obviously see in membranous nephropathy. In CLL, we generally see like MPGN, membranoproliferative, but I think in CLL we also can see membranous nephropathy. With leukemia, membranous is likely. So I guess these kind of options, they like I'm sure about all four options. They all can cause membranous nephropathy, but like these kind of options, like they have seen also ABC and BCD. So even you are not sure about like one option, so you may skip the question if you are not confident about the question. So there's 8 minutes remaining. We will just go to our mark for review. So lightning flash injuries. So lightning flash direct electric current can happen. It is correct. Air expand and repelled the air. Compressed air pushed in front of the current. So this is like looking right. Like electricity compresses the air in front of it. So it can cause injuries. Superheated air, like I do not see lightning injuries like superheated air. There were burn, but there are no specifically burns like this. This is due to lightning. We filigree burns or whatever we burns we see. It is not due to superheated air, I guess. So I'm just gonna go with superheated air. We can take some guesses while solving the questions. So we'll go 13. All the following statements are true about crush syndrome except. So we have to choose the incorrect option. Physiottomy can be performed after 24 hours treatment. Lead to a reperfusion injury when the casualty is rescued. This is correct. Myoglobinuria that occurs leads to renal failure through obstruction. This is looking wrong. Many alkaline diuresis up to 11 days. This is correct. So in the crush syndrome, I don't think myoglobinuria causes damage from obstruction. I think it's from the PCT damage, and this option is looking nice, like tracheotomy can be performed after 24-hour treatment. Sometimes we like admit the patient for 48 hours and then we do the patient muscle traction is not looking right to me. So there was this was a question of VHL syndrome with the angiomatous lesion in the fundus. So like this is also like I was thinking about the VHL syndrome with the angiomatous lesion in the fundus. So but inside the organ, like it is happening in the eye, and their spaces also are looking like so wide to me. So I'm gonna go with cavernous angioma. Capillaries doesn't sound right to me. 40-year-old complaint of blood. This is uveitis glaucoma question. Mild headache, IOP was 60, and anterior chamber minimum cells. Correct statement regarding the diagnosis. So I was thinking about the diagnosis was FHI. So this is a mild grade panuveitis. Uh, this doesn't sound right. No, it is not panuveitis. It is anterior uveitis. It can occur as a atypical uveitis and there's minimum cells. So obviously IOP is increasing like 60. So trabeculitis component will be low grade. So I'm just gonna go with trabeculitis all option because IOP is 60. There's a mild headache and there are minimum cells. So this is atypical uveitis. This is sounding correct to me. So 5 minutes remaining. We have reviewed all the questions. So in this section, I guess I have marked all the 40 questions and I still have 4 minutes remaining. So many of questions you can see, you can just do with common sense if you have just basic knowledge of the subject. Many of the answers are itself given in the like question, like that was Prakto's question. So in while giving GT, this is the important thing. You just don't have to test your knowledge. You just have to like show your common sense while solving the questions. Like sometimes the answers are given in the options itself. Like this kind of question, you just do not need the detailed knowledge about the subject. This is the basic old age female with weight loss with obstructive. This kind of picture gives like you can just solve with basic knowledge. Like the kind of shock. This is a very basic question. High hematocrit burns. So you can just solve with basic knowledge. At least 30 to 60 seconds, cooling of your head. You just have some time to relax yourself to prepare for the next section. So we have like remaining 2.5 minutes. So I can review some questions. Didn't do any silly mistake in marking them. So in the end of the section, you just check you have like attempted all the questions. I have attempted in this section all the questions. So my target is to do 190 to 195 questions for securing a good rank. So I can like skip one or two questions in per section. In this section, I have answered them all. We could have skipped some question, but like a question in which you have like eliminated one or two options, you can guess the answer in that. Like you have rule out two options, you have now remaining two options. So like according to your gut feeling, you can most of the time this becomes that is the right answer. You can get a one correct question more. But like if the question is completely strange to you, you haven't like studied any of the options the given in the question. You are not familiar with the question. You're not familiar with any of the options. You cannot rule out any one of the options. You just skip the question. You should not do attempt that question. That will instead of plus four. So we will just wait for 50 seconds for the next section. You should be mentally prepared for the next section. So in the upcoming section, you do not waste your time. So next section. So this is in section B. So which of the following is not a cause of secondary hyperparathyroidism? So parathyroidism is a cause of primary hyperparathyroidism. So you need not to see the other options. You just can check like lithium, vitamin D, CKD. They are cause of secondary, but not a cause of secondary parathyroidinoma. You are typical ones. Ataxia. Laboratory investigation revealed the elevated MCV expected in alcoholics and decreased serum thiamine level. What is the other Korsakoff syndrome? This is like confabulation. Liver disease and cellular stroke does not explain this GOE triad, GOA triad. Which of the following structure on the medial boundary of the femoral triangle? So femoral triangle boundary, it is the medial border of the adductor longus. So it is the medial border of adductor longus. Basic anatomy, cramming type of question. Increased alanine, prolonged starvation, there is gonna be gluconeogenesis. So alanine is coming. So in starvation, I'm going thinking towards the gluconeogenesis. So starvation and impaired renal function, there is no link. So B option is out. Decreased utilization of amino acid from gluconeogenesis. There will be increased utilization of amino acid from gluconeogenesis. This is wrong. There is no like plasma membrane damage and starvation. So I'm confused between during starvation, and if this is starvation, there is gonna be increased utilization of amino acids. And obviously starvation when the muscle fibers broke, muscle protein broke, that should increase alanine. So I'm gonna review later. This is a two-step question. Identify the correct treatment. So 1.5-month-old child complains of vomiting frequently. Since last 2 weeks not gaining weight, non-bilious vomiting, there is a palpable all mass. So this palpable all mass pathognomonic of CHPS, congenital hypertrophic pyloric stenosis. So treatment they have asked. I'm gonna go with it. Severe disability. So these are kind of questions you just have to study like in the last week before the exam. So you cannot remember all the topics you should write in your like 20th notebook, which you will revise in the last week before the exam. So Glasgow outcomes score. These 1, 2, 3, 4, 5. One, if the person gets like completely. No, one is death. One is death, and so I do not remember the score actually, but one is death when you are recovered. So I'm gonna skip the question. Is audio video clear? Like, Is audio clear now? Am I audible? So we were on section B. So there is some like technical glitch. Is it clear now, audio?
So there is some connectivity issue. I think some
Hello.
parts, मतलब
Is
आप
the video
बीच बीच
clear
में
now?
बीच में there is
Okay.
some disturbance. I mean the connectivity issue. You're freezing for a moment and then वो fast forward type आ रहा है. So could you just pause the test for a
Sure.
moment and check the connectivity
Yeah.
at your end? Yeah.
Now I think video is fine.
Yeah, it's a little better, sir.
So should I continue? Should I resume? I guess there was a technical glitch. So there was a technical glitch. So we will be resuming the test. So the question is about Glasgow outcome score. It is like 5, 1, 2, 3, 4, 5. 1 is for the death. So 1 is for the death, 5 is from the complete recovery, 2 is for the like comatose condition, 3 and 4. 3 will be like severe disability which requires like proper assistance, and grade 4 will be like mild disability. So I'm gonna go with 3. It is just my guess because like Glasgow outcome score is just like GCS. The more is the number, better is the outcome. I'm going with 3. One to 5 I remember. So 1 is death, 2 is full recovery. So I'm just gonna go with 3 and I will review it later. Fungus is. So this SDIRing feature is not seen in the patient history of drug addiction, symptom of cocaine overdose. Cocaine overdose, obviously there is a like agitation is right. Mostly there will be more muscle microbiome. So there is a HIV 55-year-old patient. CD4 count is 45. This is very less. So he's exposed to so many conditions. Complaints of weight loss, night sweat, fever. Hepatosplenomegaly is noted. BL fluid show macrophage filled with acid fast organism. So below 50 in a HIV patient, you think about MAC infection. So like below 50, you think about two things: MAC infection, AV infection. So there is like TB like picture, but there is a HIV patient with below 50 CTM avium complex. So this is a simple. So under MCS program, what is the composition of iron and folic acid tablet to given daily to a mother? So this is like 60 plus 500. So there is a table of like INEEP program, iron plus initiative. So there are 6 conditions. So the basic tablet will give to a like 500 microgram of folic acid. So in this kind of question, you should just check other options. So like they sometimes change the units of this, and sometimes they write. So this is the correct we have marked. So which among the following is false? Regarding hospital after a bullet injury, so trauma center, there was injury on left side of the hemisection of the spinal cord at L4. Which among the following is? So this is like Brown Sequard syndrome. The spinal cord, there is a hemisection of the spinal cord. So so you remember like this is on the left side. So on the same side there will be muscles will be gone on the same side, posterior column will be gone on the same side, but like spinothalamic kind of tract they are affected of the opposite side. So left side में कटा है, left side loss of proprioception and 2 point discrimination below the level of lesion, this is true. Left sided loss of pain and temperature below the lesion, left side, so they should be right side of spinothalamic loss. So in these kind of questions, you just read the other options also. Right side loss of pain and temperature below the level of lesion, because like they decussate inside the spinal cord, and left side of the motor loss, muscle paralysis and spasticity below the level of lesion. So there's a left side muscle, left side posterior column, and there should be right side. So this is the incorrect option. Which of the following statement is falsely matched? So you have to correct the match the incorrect. So antemortem wound vital reaction will be positive, like if the wound is before the death of the individual. Antemortem wound negative vital reaction, like vital reaction will be present. It may be positive, it may be negative. Postmortem would negative vital reaction. So this is the like basic we study in injuries of FMT. So if there is any wound which is antemortem before the death, there will be a vital reaction. It may be positive, it may be negative. And Jam wing could be no vital reaction. So these A, B, and D are correct. C is incorrect. They have asked the falsely matched. So in postmortem wound, there will be no vital reaction. Negative, positive, nothing type of vital reaction will be seen. Like acidosis, etc. So this question also came in this recent INI exam, this 10th of November. So high in anemia metabolic acidosis is like is all our courses except. So you have to. So if you remember the brachial plexus, there is C5, C6, C7. Audio video good.
Sir, so there is still fluctuation in your audio and video. Dr. Ravi, am I audible to you?
Yeah, you are audible. So like
Yeah.
video is not going smoothly. Is it pausing?
I didn't get you.
So like video is stuck sometimes, right?
Yeah, it is just getting stuck at points and then it is
Mm-hmm.
resuming after a lag of 10 seconds. So we are missing
Sure.
your key insights that you are actually discussing about that why you are on option A, you're saying option A is wrong, but the next time it's taking directly to option D when you're marking option D. So wo lag aa raha hai.
Oh, okay.
So what I suggest is, sir, that we pause this here. There is an option anyway to
Mm-hmm.
pause the test that you have already done here, right? So
Mm-hmm.
you pause the test over here. We will take it up tomorrow same time, and you can
Mm-hmm.
resume it from here.
I suggest just let's try for once. Further
Yeah,
problems occur, then we'll continue tomorrow, right?
sure.
So like this is a live session. This will be continuity. Okay, so let's resume the test. So the question was about like after mastectomy, the female patient complaining of winging of the scapula. So this is a basic like first year anatomy question about injuring the long thoracic nerve during the mastectomy. So like if you remember the basic brachial plexus, so C5, C6, C7, there is a nerve going long thoracic nerve is supply the medial border of like scapula. So which of the following is true regarding changes in puberty? So puberty, they have given a sequence. So these kind of question, you may not remember all the things. You have to check all the options to get the right. So like in this, so I have like remember this like an acronym TPM, teacher parents meeting. in like puberty, when the puberty is happens, these there are PTMs. So like in the options, like menarche cannot occur before like T and P. TMP. This cannot be right. Menarche cannot occur before T. So this the option growth spurt, then thelarche thing TPM. First option by gestation. TPM is also only common congenital heart. Goal is seen in like Turner syndrome. It is not most common congenital heart defect. Tricuspid stenosis cannot happen. Like I am confused between these options: mitral stenosis and mitral regurgitation. Both are old defect. So I am more like inclined toward mitral stenosis, but I will review the question later. Yes, I have posted the
Hello,
question.
hello, sir. So, uh, though there's a lot of chatter around in the world about technology taking over humans, but technology has this bad habit of hurting humans at the most crucial times, letting us down at the most crucial time, and that is what is exactly happening here. There's a little bit of internet connectivity issue at your side, because of which there is, a lag in both your audio and video. I suggested that we pause the
Mhm.
test over here and we resume the part two of this live stream, because the key insights that the students will benefit the most from, the key learnings, that part वो थोड़ा miss हो रहा है sir, because of the voice lag and because of the
Yeah,
video
no
lag.
problem.
Yeah.
Mhm.
So I think we can resume tomorrow same time, sir, if that is fine with you.
Yeah, yeah, yeah.
Yeah.
That's fine.
So guys, that's that's about it. Tomorrow, same time, Dr. Ravi will come back here and resume the test from where he has paused, and he will take you through the second part of this particular video. And we hope tomorrow, uh, and we're sure tomorrow that we will have a much better internet connectivity so that the stream goes seamless. Thank you so much for watching this. Let's catch up again tomorrow. Thank you, Dr. Ravi.
Thank you.